Shall we discuss malnutrition screening?
Ah yes, the famous screening.
Yes, screening should be carried out using a standardized malnutrition screening tool. It should be completed yearly for an elderly person who is living in their own home, or once a month for those living in residential care. However, if the elderly person is identified as being at high risk of malnutrition or has certain medical conditions, the screening may be completed even more frequently, for example, weekly.
What do you mean by a person at risk?
People could be identified as having no risk, being at risk, or at high risk of becoming malnourished. The first step for the screening is to identify a person's risk factors, such as weight loss, medical conditions including cognitive impairment, and difficulties with chewing or swallowing. It is important to consider any medication they are taking and the potential impact on their appetite and digestion. And finally, other difficulties, such as social isolation, widowing, or loss of independence, are all key factors that should not be neglected when identifying a person's risk of becoming malnourished.
What should be the first step?
Beyond considering their nutritional intake, checking a person's weight is the first step in screening. Then it is important to calculate their body mass index, or BMI. You have the formula here. This information can then be used to complete a mini nutritional assessment or any standardized tool in your country.
And concretely, what does it mean?
You would normally be considered malnourished if you have a BMI of less than 18.5 or if you have unintentionally lost more than 10% of your body weight during the last 6 months. Identifying a person's level of risk can help the supervising healthcare professional develop an appropriate management plan.
Thank you. I see why screening for malnutrition is a path to better care.